The broadcast is now starting. All attendees are in listen-only mode.
Hi, and welcome to the South Florida Regional Planning Council webinar on improving regional transportation planning in Miami Dade County via enhanced local access to healthy living. My name is Keren Bolter, and I'm here with Council staff Christina Miskis and Vince Edwards, and we're going to be talking to you today about some of the projects that we have been working on. So this is basically the overview of the webinar. We're going to do, I'm going to start by doing a review of the previous study where I was the project manager that we're kind of building upon for this subsequent study. Vince is going to take over and do a demonstration of some web visualizations that we've created for this project. And then Christina is going to take over with talking about the different opportunities and directions for our project, recommendations, and next steps moving forward. So some background about the project. We're really focusing on healthy living and mobility in Miami-Dade County. This project is was funded by the MPO, for phase one. Since they've changed to be the TPO, the transportation. So for phase two, we're working to really hone in from phase one. So phase one, we worked on 7 neighborhoods, and we really looked to identify gaps in transit and mobility infrastructure. And these gaps really make it difficult or even impossible for transportation system users to access healthcare services and healthy foods. So what we did was, looking into this nexus of data, overlaying transportation data, health data, other types of community demographic data to really find some gaps and make some recommendations. So that was phase one, and I'm going to go through what we did for phase one, and then we're going to talk more about how we're doing the phase two. We've done some focus groups with the 3 different communities that we're focusing on for phase two. We've also put together this webinar, and moving forward, we're going to be talking more to different stakeholders and doing specific PowerPoints for the 3 communities. So what are the neighborhoods that we looked at? In phase one, these are the 7 neighborhoods that we looked at. So you can see that most of them are in the city of Miami, and then we added the 79th Street CRA and Opa-locka. But we had Grapeland Heights, we had Little Havana, Overtown, Downtown, and Liberty City. And the reason that we chose these 7 neighborhoods was because we found some previous research that identified these neighborhoods as food deserts. So for the phase two, we wanted to really zoom in on the scope, and we talked to the focus groups, specifically with the City of Miami and some other organizations, to see which ones we really needed to look at, and we wanted to go in the direction of like modal split, bike ped mobility. And so that's how we decided to focus on the 3 neighborhoods of Overtown, Liberty City, and we did the 79th Street CRA, but we stretched it further east past 95. So this is the purpose of the original study, which I'm going to be focusing in on now. Really identifying these gaps and looking at health services, healthy foods, and exercise. And we really want to understand, where are these gaps and how do they hinder access to healthcare services and healthy foods? So what kind of data are we looking at, and how do we assess it? That's what I'm going to get into. So these are the types of things that we want to look at when we're looking at safety and mobility. We want to look at public health, healthcare, so all the different facilities that are available. That data was the facilities were readily available. The health data was a little more tricky because most health data is private, and if you can find it, it's at the county level, maybe zip code level. So that was one of the biggest barriers, was finding some good data for health. Also looking at healthy foods and fitness. So those data layers were things like parks for the fitness, and for foods, grocery store locations, and then where are the fast food areas, so for the methodology, really what I did was I wanted to look at the baseline conditions and risks. So for that, I really looked at the land use, socioeconomic data from the census, and just what's the current condition. Overlaying that with the health data, and trying to understand, what are the different resources, and what are the community indicators. So we really tried to get at the neighborhood level. It was important to focus on the block group data. So I'll talk more about that. The opportunities for exercise was really looking at the different parks, the gaps in transportation. That was using data, transportation routes for a lot of public transportation, the Metro Mover, Metro Rail Bus, also overlaying that with facilities like hospitals, police stations, and really overlaying that, we were able to identify some gaps in transportation. And I'll show you those different maps for the results, just a few of them, but if the report is available for everyone. Also, we did some online visualizations using the Weave tool for the Fair Housing Equity Assessment Indicators, and all of that came together for some recommendations, which I'll end on. So here's the baseline risk. So one of the main ones is, here's all the communities and what the median household income. Looking at this map, you can see that the darkest blue is really, the less than 20K per year is, really an issue. So Overtown really stood out among the communities as having almost all dark blue. So this is just one example of how we did the baseline risk. Median household income is a pretty substantial indicator. Another one, so we're looking at the land use. We're able to look at the different neighborhoods and see really a lot of residential in most of them, but then, of course, going into downtown and Overtown, we had a lot less residential. So I mentioned those Fair Housing Equity Assessment Indicators. These were put together for the 750 project, and there were 31 of them, but we chose 15 that were really indicators for social equity. So for these indicators, we created a whole range of visualizations for each community, and the links to those are all in the report. So these are really interesting to look through. I recommend that you explore them on your own time. So this is also a really interesting study that was done. It was the Child Opportunity Index, which is a measure just for youth that measures relative opportunity based on educational opportunity, health, environmental, social, and economic. So these are the kind of things we really wanted to focus on, because it's all about aggregating different variables to create something like an index to really get a picture, like a bigger picture of what's going on. So we were able to see, the darker reds in these areas show that there's high opportunity, and then the lighter colors are very low. So we definitely see a cluster around a lot of our study areas, Opelika, Liberty City, where there's clearly the lowest on the index. So this is one of our variables that we considered. Another really important one was this study done by the Food Trust. And what was interesting here was they looked at diet-related mortality by income. They found that 10% of residents in Miami Dade County, and that's 250,000 people, live in clusters of low-income areas which have reduced supermarket availability, and it's correlated with increased rates of diet-related deaths. So this cluster is the red here. So that's really, a lot of it is unincorporated Miami-Dade County, Opelika, and then the western parts of the city of Miami. So these are really a hot spot for putting together all of our indicators that have to do with the, lack of access to healthy living. And then, adding that, so we looked at this data and really added the transportation barriers, and that gives you a bigger picture. The transportation barriers have a direct link because they are correlated to reduced healthcare access. There's missed appointments, delayed care, lack of medications, absence of preventative care. So in addition to this travel burden, there's other factors. There's crime and poverty, which intensify these adverse health situations. So it's really important to look at this data. And this is pretty compelling as a hotspot. So let's move into the results. So all of this was kind of overlaid with the data that I collected. So if you see this map, we actually combined 4 of the neighborhoods into one map. So downtown, Overtown, Grapeland Heights, and Little Havana. And so, when you really look at these maps, you can see some of the gaps in the transportation. For example, in this one, Grapeland Heights has relatively less access to the hospital. So the hospital is the red cross here. So you can see there's no hospital in Grapeland Heights. Also, there's one area of Grapeland Heights around Northwest 32nd Avenue that has no north-south routes within a quarter mile. So that's a huge gap in the transportation that we can see. And this is just an example of one of the maps. I didn't put all of them, but these maps were created for all of the neighborhoods. Also, this was a really interesting map that we created for all of the neighborhoods. So I focused on, for this webinar, the 79th Street CRA, because I saw this very big difference between the red circles and the green circles. So what the red circles are, they're areas that have high supermarket. The red circles have low supermarket access. So if it's red, there's very low access to these S's, which are the supermarkets. If you are a bigger red, it means more people have less access. And then the bigger green circles means more people have more access, whereas the smaller green circles, less people have less access. So putting that together with the other different resources like the police stations, the bike lanes, the parks, and then the different public transportation routes, you can kind of get some ideas of, if there is limited supermarket access, maybe the transportation gaps can be filled to enhance that. Because clearly, it's hard to move a supermarket, but helping someone get to the supermarket. So we can see here in the 79th Street CRA that the largest need runs along Northwest 68th Street and Northwest 21st Avenue because they have the largest red circles and just not a lot of transportation opportunities to get to supermarkets. So, these people that live there might be going to the corner stores, which don't have fresh fruits and vegetables. They don't have a lot of healthy food options, just a lot of kind of junk food, fast food in this area. So this is another map of the results. And these maps, again, were done for all of the different neighborhoods, and they're in the report. So moving on to the next set of results, and this is some preliminary results for phase 2, because we realized that with the recommendations, we wanted to look more at pedestrian bike mobility, and so we started looking at the fatalities and crashes, and we found some serious hotspots in our neighborhoods. So what you can see here is the X's are fatal bicycle crashes, and the red are fatal pedestrian crashes. So we have a cluster, towards the south along Little Havana, and then in the north along the Little River area, 79th Street. So you can see the map on the right is kind of zoomed in. And this is just the fatal crashes, which, by the way, this data set is from 2009 to 2013. So this is it's one thing to have the fatal crashes, but what about overall, any crash that involves a bicyclist? So these crash counts, tell a different story, but definitely, some clusters, same cluster to the south that area south of Little Havana, and then a cluster along Edgewater that we can see. So these, I'm going to wrap up. These are the recommendations that we came up with at the end of the first report, and really a lot of it had to do with the limitations in terms of available data. You know, it was looking for data on crosswalks, on lighting, you know, shade, and a lot of stuff was missing. And this would really help, and again, health data. So all of that would help with really understanding what these gaps are. But one of the biggest recommendations was to really ramp up the complete streets effort and focus on improving access to different health opportunities, and look at specific health access needs related to emergency services, health services, connecting communities, and connecting people to economic opportunity. So I'm going to hand it over to Vince, who's going to talk about the visualization. Here you go, Vince. Thank you.
All right, thanks, Karen. So I'm going to pick up here and walk through some visualizations that we put together in my sidewalk for the Miami area, and zoomed in on some of these communities we talked about. So let's switch over to those right now. So this first visualization we're going to look at, and these are all built in my sidewalk, which is a web-based mapping platform. So the first one we're going to look at here, you can see this is the city of Miami, and we have our 3 communities. So up here we have the 79th Street corridor. And if we zoom down here, just turn some of these off. All right, so we have the 79th Street corridor here, and Liberty City here, and then we have Overtown down here. So this layer we're looking at right now is vehicle availability. And so this is shading for the given block groups in the area based on the number of households that have no vehicles accessible. So that can be either they do not own a vehicle, or they do not have a vehicle currently leased in their name, anything like that. So it's just the raw number of households. So you can see there are a couple of hotspots, and that could be for a variety of reasons. That could be due to income, that could be the density of the area, so perhaps a vehicle is not needed. So another interesting way to look at this would be to normalize this data. So right now it's simply raw counts. So if you pan over any one of these block groups, you can see the number of households that do not have access to a vehicle. And that has a lot of implications, picking up on what Karen was just talking about. So access to grocery stores, access to parks, access to gyms, access to healthcare, hospitals, that sort of thing, access to jobs. So these has a broad array of implications. But another way to look at this is also to normalize it, so you can see the density, get it in as a percentage rather. So this gives you the percentage of households that do not have access to a vehicle. So that's just another way of looking at it. And again, you can see there are some hotspots here. And so that has, that has a lot of different implications. So let's move on to another one here. So this is the same area, same communities. And here we are looking at the number of individuals that commute to work via bicycle. So once again, the higher numbers are shaded in darker shades of magenta. So you can just get some raw counts here. And these are taken, this is block group data, and this is taken from the 2015 5-year ACS estimates. So again, you can see there are a couple of different hotspots around. And again, this could be for a variety of reasons. This could be people are not walking or not biking to work because they own cars. It could be that there's a higher number of people that are going to work or not going to work, so employment has a big factor here. It could also be a safety concern. So there could be areas where no one is biking to work because it is simply not safe to do so. So again, we could normalize this and get the raw percentage of those that are that are biking to work. Another cool feature of this platform is that we can come over here and get some additional data about the area. So as we scroll over these block groups, you can see that the data will change and update as you scroll over. So you can, if you scroll down here, I've added one in here that's travel time to work. And so this can just help you get a better idea of the causes behind the trends that you're seeing. So over in Miami Beach here, it appears that there are a larger amount of people that are biking to work. And so, you can make some predictions about why that may be. It could be access to jobs, it could be the safety, it could be that their travel time is shorter. So adding these additional data sets over here can kind of help you better understand the patterns you're seeing with the visualization in front of you. So let's move on to another one here. So this is walking. So again, this is similar. Similar data set, and there are similar trends as well. So again, you can see in places where perhaps the access to jobs is higher, perhaps it's safer. Those are all things that you can look at in greater detail. And then in areas where, potentially, as Keren showed previously, there are quite a few accidents in some of these areas. So perhaps that has something to do with someone's ability to walk or willingness to walk. And in the next visualization, we'll look at access to jobs. So if the access is low, that would also limit your ability to walk to work. If your commute time is much higher, or there simply just are no jobs around to walk to. So another would have been more appropriate to turn this one on for the bike visualization, but we'll show you here anyway. So this here shows bike lanes, and this is a layer downloaded directly from Miami's GIS warehouse. And so these are great. So you can also, you can potentially make some inferences about where these bike lanes are, how many people are walking versus driving, and that sort of thing. And it can also show some opportunities for where perhaps there are places where these exist, and yet there are still few individuals that are actually using them to commute to work. And again, that could be for a variety of reasons. And adding these additional charts over here can help you infuse extra data layers, and you can make extra inferences. And then, of course, ground truthing is always an important final step here. So these can be great, but what's also important is to ensure connectivity and that sort of thing. So if they don't connect to places that people want to go, so be that jobs, be that supermarkets, be that parks, that sort of thing, or simply connect to other paths within the larger, broader network, then they may not be as useful as intended. So just to move on to one final thing, I've talked about this a little bit. This is now showing the job proximity index. This is produced by HUD. This is 2014 data. And so the way this works is it's an index, goes from 0 to 100, and it is ranked for every census block group we're looking at here, based on that neighborhood or that community access to jobs. So their proximity to jobs, to employment centers, that sort of thing. And dense downtown areas where there are a large number of jobs get weighted higher than smaller areas such as strip malls and that sort of thing, corner stores, that sort of thing. And so again, when you look at this next to the number of people that are commuting to work, period, either by car or by bike, and then if you look at that in conjunction with the number of people that even have access to a vehicle, it starts to paint a bigger picture of some of the trends in the community, how accessible transportation is, and the methods that people are using to get around their communities. So you all should have links to these visualizations, and we'll make sure that we leave these up so they stay active. And with that, I'm going to go ahead and turn it over to Christina, who's going to walk through some opportunities and next steps moving forward.
Yeah, so I'm going to share this PowerPoint with everyone, and these different these are hyperlinks. So you will be able to explore those visualizations on your own using the hyperlink. So we'll send those out to you as soon as possible, right after the webinar. Take it out.
Thank you. Thanks so much, Vince. So what we saw from Keren and Vince was a need for opportunities for improved mobility. We saw a dependency on bike and ped mobility for our communities to access healthy living, to access supermarkets, to access their jobs. But what we're looking at now is opportunities to improve their safety in terms of the opportunities for mobility. And FDOT, the Florida Department of Transportation, recently published a draft of their new Complete Streets Handbook, which is what we heard from the focus groups as being a priority for implementation in our communities to improve access to healthy living and to improve access to mobility options in our neighborhood communities. And what FDOT has done is they've been fairly responsive to communities' needs, and in doing so, they're trying to improve the options that communities can access to change the design and characteristics of streets in their neighborhoods. So Complete Streets is the idea of making the roadways in our neighborhoods more responsive to the needs of the users of all ages and abilities, pedestrians, bicyclists, transit riders, motorists, and freight handlers as well. And the difference this time is with the most recent Complete Streets publication is that, and it's a real game changer, is that well, now we have the opportunity to do context classification for roadways. And what that means is that we will be able to have the opportunity to classify roadways in terms of the communities in which they transect, in the communities that they serve. So we'll have the opportunity to look at classifications, and we're going to be working more on this in the near future in terms of classifying the roadways in the communities that we're looking at. But the context zones that we'll be able to look at in terms of appropriate classifications would be rural, rural towns, suburban, urban, and urban core. And for example, if you looked at 79th Street, perhaps you could look at the urban or suburban uses. And within those classifications, you would be able to choose different design characteristics that would be more appropriate and perhaps improve the safety and mobility, hopefully, of the communities that they transect. In a suburban setting, you would find a roadway that's with mostly residential uses, with large blocks, and not so much a connected roadway network. In an urban setting, you would find a mix of uses that were in small blocks with a well-connected roadway network that makes them long distances. The roadway network may connect to residential neighborhoods immediately along the corridor or behind the uses fronting the roadway. So this may seem very technical, but it actually really improves the options of the community in terms of design. For example, this is a visualization of the types of roadways that we could use to we could classify within our communities. All the way to the left, you would see the C1 natural environment where the lands are preserved in a natural state, lands that are unsuitable for settlement due to natural conditions, and all the way on the left, you would have an urban core, areas with highest densities and building heights, and within FDOT classified large urbanized area populations. So it would have very different design characteristics. And somewhere in the middle, I think, or towards the right, is where most of our communities would lie. And if we do this context classification, it'll provide more options, as I said, for safety and mobility. Because in the past, what traditional departments of transportation have done is is make this an auto-oriented world. And this is trying to really be more responsive to the communities in which the roadways lie. So instead of having an auto-oriented roadway, you would be able to potentially put the roadway on a road diet and make it more responsive to pedestrians and bicyclists. This is a blow-up of the types of roadways that you could choose in terms of classifications, all the way from C1 natural to C6 urban. And this is taken from, this quote on the next slide is taken from FDOT's new Complete Streets Handbook. And as it says, it allows FDOT greater flexibility in design. And the Complete Street approach, it helps match roads to their locations. It puts the right road in the right place and provides a multitude of opportunities for enhancements in terms of design. A lot of times when, engineers, civil engineers come to the table and they try and design a roadway in neighborhoods, they have a very limited knowledge of the neighborhood, and they may have very limited options in terms of the design from which they can choose. But if we have a context classification, they will come to the table with a baseline understanding of the community in which they're working. And that'll really provide professional engineers an opportunity to really be much more responsive to the communities that they serve. For example, this is an example from Tucson, Arizona, where a typical bicycle boulevard has been designed to be very responsive to the high bicycle usage in that city. One example of the type of design that would be available in terms of a bicycle boulevard, if you had a classification that would allow this type of design to occur, would be a chicane. A chicane serves as traffic calming treatment and is an opportunity for green infrastructure. And it's a very progressive design, and it really helps safety and mobility of pedestrians and bicyclists in local neighborhoods and then their access to healthy living. This type of chicane would not be available on a normal roadway. It would not be available as an option for design on a regular roadway that was auto-oriented. But if you had a context classification that would allow this type of chicane to be used, it would create enormous benefit to the safety and mobility of bicyclists and pedestrians. This is just one example. And the following slide shows what a chicane would look like. And this is just one example of what a chicane would look like. It doesn't have to look exactly like this. It could be modified to serve the needs of the neighborhood. This is an example of obviously a suburban residential neighborhood, and the chicane is being used for traffic calming. And this would help in terms of improving the safety and the mobility of the pedestrian and bicyclists and to calm the traffic going through the neighborhood. However, it doesn't have to be limited to such a rural residential context. It could also be used in an environment where you have very high bicycle and pedestrian needs, as we do in our communities in which we've studied. For example, on 79th Street, we have, we actually have high transit usage, and I'll go back to the past slide. Have high transit usage, and there's really nothing to protect the transit users from the road traffic except striping on the road. A chicane would allow like a physical infrastructure to provide safety for those transit users to wait and board their transit, their buses, and also, provide them with further safety opportunities to use, bicycles if they wanted to. So as we move forward in this study, what we're going to be looking at is context classification and looking at what would be the opportunities in the major corridors in our neighborhood in terms of their classification, and how would that really improve the opportunities for improved design to be more responsive to the communities and the needs of the neighborhood.
Great. I think that was awesome. Thank you, Christina. Thanks, Vince. We're going to open it up to questions. So I know that everyone is muted, but I'm going to unmute you guys. Unmute, unmute, unmute. Okay, everyone's unmuted. Do you have questions? That's okay. You know, I was thinking about the side streets, and something I've noticed is that people using Waze, the Waze tells you to avoid the main streets when there's traffic on the main streets, and it's actually getting people to zoom down side streets. And I feel like there's going to be some correlation there. I mean, you've already seen there was somebody in Davie that there was a death, like someone just zooming down a side road around the university, and you know, people are just speeding in the side roads because the Waze tells them to go that way. So I think that's something that should be at least noted.
Yeah. Challenges are going to be improved and be increasing, not decreasing for sure.
Okay, well, what I'm going to do, since there's no more questions, is I'm going to send everyone the PowerPoint. The calendar invite has the report attached to it. And I'll show you guys. I'm going to mute you again.